Hello viewers, welcome to yet another episode of Dr. Sin. This is me, Naina, with you. Today we have with us a special guest, and his name is Jeffrey Weiss, who have come all the way from Africa, and he is a world leader in retinal surgery, and he is a consultant in Al Zahra Hospital, Dubai. So let's welcome him to the program. Hello sir, welcome to the show.
Hello.
Firstly, we would like to know about your medical education and your specialization.
Well, my undergraduate degree is in electrical engineering, which I obtained while I was in medical school. I graduated summa cum laude. I did a year of general surgery. I was going to be a cardiac surgeon, but I did some and found it was very repetitive and looked into something else where I could combine my engineering and my medical abilities, and I became an ophthalmologist. I did a 3-year residency in ophthalmology, and then I went to Harvard and MIT and did a fellowship in ophthalmologic bioengineering. I was the first fellow they ever had in that field. After that, I went to the Johnson Diabetes Center, and I was the youngest person to get tenure. I was a senior physician there and chief of retinal surgery at the Johnson Diabetes Center in Boston. I was director of a research laser laboratory and had retinal fellows. In my position there, I lectured around the world. I'm also an inventor. I hold approximately 20 patents in medical and in other fields. In 1998, I invented the equipment to cannulate retinal blood vessels for central retinal vein occlusion. This is the first time it had ever been done. And to this day, my results are still better than anything else out there. And patients came to me from all over the world to my office in Florida near Fort Lauderdale for that procedure. I've done more than 500 cases. Approximately 6 years ago, I used hyperbaric oxygen to treat certain untreatable retinal conditions. That also made TV news. I published more than 90 papers, 5 books, book chapters. In 2010, I was the first in the world to perform retinal stem cell surgery. At the time, I could not do it in the US because of the FDA. So 2 American patients met me in Germany, and I did the surgery there. 1 patient was interviewed on television afterwards and read a large print book on television. And if you go on YouTube and type in retinal stem cell surgery, you can see that interview. In 2011, I did 7 more American patients, again in Europe. But finally, in November 2012, I received approval to do the procedure in the United States. My approval is IRB approved, and I'm registered with the NIH on clinicaltrials.gov. You type in eye stem cells, it's a SCOT study, Stem Cell Ophthalmology Treatment Study. It's the #1 study in the whole world. I have now done more than 250 patients. The other 14 studies around the world have probably done less than 30 put together. In March, I came here and saw patients. I'm licensed in Dubai. In June, I operated on 4 patients here. And this past Saturday, I saw 3 of them. The 4th patient's in Jordan, so that patient didn't come. And all 3 patients had improvements in vision, which is a miracle because I'm operating on people who are almost blind. So if you operate on somebody almost blind, you're not going to make them blinder, so they can only gain. And fortunately, it's a miracle. All 3 people gained. And it makes a huge difference when you don't have much. I mean, the family was happy that the patient was able to walk by themselves and not knock into the walls or into furniture. And the patients were so happy, and it made me extremely happy, and which is why I'm doing this TV interview, to make people aware of this. I mean, I've been a retina specialist more than 30 years, and this is the most miracle thing I've ever seen. Well, I've been a retina specialist for more than 30 years and fixing retinal detachments and doing laser treatments and doing all kinds of retinal operations. But this is unique, and I started this and I invented some of the equipment that I use, and that's where the engineering comes in. So these are the Weiss needles named after me that I use, and because if I see something I need, I can invent it myself. And it's just a marvelous thing to be able to help somebody.
So what are the challenges that you have faced in your career?
Well, it's a very hard road to do anything new. It takes years. With the cannulation surgery, people said it was impossible until I did it. With the hyperbaric, people don't know about it. So they say it doesn't work because they don't know about it. But I published articles, 6 articles. If you don't read, you wouldn't know. You could be inside the house and close your eyes tight and say there's no sun. But that's just a stupid person. That's ignorant. And that's not a physician. A physician wants to help his patient. A physician does not accept that there is no treatment. There may not be a treatment now, but you work towards a treatment. Things that used to be untreatable are now treatable. And if you don't work towards it, you might as well sit in your house and do nothing. And that's unacceptable. We became physicians to help patients. And as I said, with the stem cells, I wasn't allowed to do it in the US because of the FDA. I had to go to Germany and Austria to do the work. And it took several years of lots of writing and meeting with the FDA. And now I'm allowed to do it as of November 2012. And the first patient I did was a 32-year-old lawyer who had a brain tumor operated, and he was blind. And his mother had to lead him into my room and put him in the chair. And he told me that he just sat in the chair all day long. He had no life. And it was horrible. I said, well, we could try this. He said, my life is over. I have nothing to lose.
So sad to see those kinds of
It's horrible. But 9 months later, he walked into my office on his own. And he sat down in the chair and looked right at me. And he got a girlfriend, and he was going to get married.
Okay.
And he wanted the procedure again to see if he got more. So I told him to wait a year, and we did it. And then he came back 9 months later, and he got married, and they bought a house, and now he's back practicing law. So that's a miracle. Another young girl who went blind, she wrote me a beautiful letter that she was engaged to be married. She had never seen her fiancé's eyes, and now she did. Now she could see her fiancé's eyes because of what I did.
That's great. So
It's fantastic.
So now, how do you do this procedure?
It's a 1-hour procedure. Most of the time, the patient's asleep, although we can do it under local anesthetic if the patient doesn't want to be asleep or if they're not healthy enough to be asleep. The first part is the patient's own stem cells are taken from their hip bone. It's called a bone marrow aspiration. It takes only a few minutes. And that bone marrow aspirate is placed in an FDA-approved special type device that separates out the cells.
Okay.
And we have a special protocol to minimize the amount of red blood cells and maximize the other good cells. And then those cells are given to me, and I inject them sterilely around and into each eye.
Okay.
And the whole procedure takes 1 hour. We don't have to put a patch on your eye. It doesn't hurt much, quite frankly. People complain sometimes a little scratchiness, but other than that, it really isn't bad.
Is there any precautions to be taken before the procedure is done?
Well, I don't want people to be smoking.
Okay.
In fact, I really prefer not to even do people who smoke, because if I give you the stem cells and you smoke, you kill them. I mean, it kind of defeats the purpose. If I'm trying to help you, you have to help you too. And certainly if you're diabetic, you should take care of I mean, normal, common sense things, you should take care of yourself.
Yes.
And most people do, or try to. But other than that, there is nothing special. I don't stop any of the medicines that they take. The procedure is outpatient. You go home after the procedure or to a hotel, and then I see you next day in the clinic and a second visit,
Okay.
and then that's it. You
So
go
I
home.
don't have to come and visit you again? Yeah.
Well, no, the normal procedure when I've done it here at Alzira Hospital in Al Barsha is I would see the patient on Saturday, I would operate Sunday, I would see them Monday and Tuesday,
Okay.
and then that's it. In a month, they can see their own ophthalmologist,
Okay.
and what happened is I would see them in 3 months when I returned to Dubai.
Okay.
And that's what happened now. I operated in June. They saw their ophthalmologist if they were from another country like Saudi Arabia. And then in September, they came back to see me. Although it's not necessary to come back to see me. They could see their ophthalmologist, and he can just send me the records.
Okay. So now what is the BMF?
Well, BMF is bone marrow fraction, and that's the material that we separate out from the bone marrow aspirate, and it's then injected.
Okay. So
Okay.
could you explain in detail how the entire process of BMF is done?
Well, it's a special centrifuge. This is FDA approved, and it's not just a regular laboratory centrifuge. There's a hard spin and there's a soft spin to keep separating out cells, and we have a computerized protocol to minimize the amount of blood, because we don't want to inject blood into the eye. And it takes about 27 minutes to separate out the material. Yes. But this is all done simultaneously while the patient's in the operating room. So the entire process, from the beginning to the end, takes less than an hour.
So why did you come to Dubai to visit rather than going to some other place?
What was happening is patients were coming to me from all over the world to Florida. But patients from this area were having a very hard time, and increasingly a hard time, getting a U.S. visa. And we had some people from Saudi Arabia, it took them a year. Somebody from Iran, it took them a year to get a U.S. visa, which is really unacceptable. And so I thought that this was a good central place for people to come. And I visited in 2008 because some of the medical equipment I had invented was being exhibited at Arab Health. And I liked it. And then the last several years, when I was doing the bone marrow fraction procedure in Florida, and the people were having such hard times getting visas, I said, well, I should come back here and let me see what's going on. So I came back a couple of years ago, and then I visited every single hospital. I met with the chief executives, and I met a lot of the ophthalmologists and retina specialists. And Alzira Hospital was very new then. It was just opened. And it looked like the perfect place, and they were very interested in this. And in January, I was part of the U.S. delegation at Arab Health, which was very nice.
So how do you feel after coming here?
I really like Dubai. I've given 3 lectures to physicians. Like the most recent one was this past Sunday. The people are very friendly, and they're very nice, and they can't help you enough. And I just really enjoy it. It's a very nice, clean, hard-working place, and everybody is very, very nice. So I enjoy coming here.
So now could you just tell us about your experience working in Alzira Hospital?
Well, they couldn't be nicer to me. Anything they can do to make my experience better, they do. They've become my friends.
Okay.
We're friends now. And it's nice when you like visiting your friends. And it's a beautiful hospital, and they have the best equipment, and I enjoy working with them.
So how often you visit here?
Well, I've been coming every 3 months now.
Oh, okay. Okay.
if it gets busier, I would come more often.
And you'll be here for how many days or months?
Normally when I come for about a week.
Oh, okay. So that was nice talking to you. Thanks
You're
a lot
very
for
welcome.
coming.
I appreciate the interview.
Thank you. So that was Jeffrey Wise with us. Until we meet next time, this is me, Naina, signing off. Take care.